lines, everyone, and our panelists will get started right now. Perfect, and we are recording. President Anderson, let me turn it over to you.
All right, well, I'd like to welcome everyone. This is very exciting to have so many participants, especially for something that we put together pretty quickly. We do want to thank Amanda and the American Ambulance Association for their assistance. We couldn't have done it without them. So we want to talk about, there's a lot going on obviously in the state legislature right now. We want to talk about how it affects EMS throughout Wisconsin. And we're going to get into that in a little bit more detail. My name is Chris Anderson. I'm president of the Professional Ambulance Association of Wisconsin. I'm joined today by Chief Timothy Bantes, who is the president of the Wisconsin State Fire Chiefs Association, Marc Cohen, who is the executive director of the Wisconsin EMS Association, and Lieutenant Jerry Biggart, who is executive board member of the Professional Firefighters of Wisconsin, also with the Oak Creek Fire Department. And throughout these four organizations, we represent pretty much every EMT or paramedic in Wisconsin. So we're pretty proud of that fact. So we will be asking some of these panelists to join in as we progress through the presentation. I don't think it's going to take too long to get through the information that we want to cover, and then of course we'll open it up for some questions in the chat box, as Amanda mentioned. Everyone knows what's going on right now is unprecedented. We don't have to tell you that. Wisconsin is a large state, however, and we have different populations, we have different sized cities, we have rural, we have urban. As everyone has seen, our biggest urban area in Milwaukee has been hit the hardest with COVID-19. I think for the most part, it's been more than half of the cases, or right around half of the cases in the entire state. It does appear, based on some of the data, that COVID-19 is impacting vulnerable populations disproportionately, elderly, people of color, chronically ill, and economically disadvantaged. And unfortunately, Milwaukee does have all of those groups, and in some large numbers. What we do, though, none of that matters. We take care of everyone that needs our help, and we're proud to do that every day. We still do that. We have not changed. We're doing that in the face of a pandemic. We do it, you know, in snowstorms, heat waves, it doesn't matter. We are seeing a lot of people accessing the 911 system for help. They don't necessarily know where else to go. And so oftentimes EMS is their primary care. And so that's putting a strain on the system. And that's kind of what we're here to talk about today. You know, the state government is working right now. The legislature, the assembly voted yesterday, and the Senate is expected to vote later this morning to accept federal dollars to help. And basically our message is this, it's pretty simple. We want the legislature and then the governor, who will ultimately have the power, to approve an emergency rate increase for Medicaid and for EMS in Wisconsin, and to make sure to include EMS in all waiver applications. So what that means is the governor's office has published a list of groups that they're planning to assist with federal aid, hospitals, long-term care, that kind of thing. We want to make sure that EMS is included. We're sometimes forgotten. We are a small provider group compared to some of the bigger players, but what we do is vital. We're on the front lines. You know, our personnel are the first to encounter patients, particularly COVID-19 patients, and that's been a little bit scary. If you look at just some of the data here on this chart, across the U.S., at least as of a couple of days ago, there have been over 13,000 EMS personnel exposed to COVID-19. We have more than 6,000 in quarantine, which further impacts our ability to do our jobs. And we've had over 600 EMS personnel diagnosed with COVID-19. We've all seen the horror stories from New York. We've lost some EMS providers, not just in New York, but in other parts of the country as well. And none of this is meant to minimize the suffering that's been occurring throughout the U.S. and throughout our population. We're just wanting to point out that we're sometimes at a higher risk because of what we do. We don't slow down and we don't stop. We still go in and we still help, no matter what. COVID-19, as we mentioned earlier, has impacted our entire state. Just a little bit of data there, and of course we will have these slides available for you. One thing that's been a little bit tricky for us and has caused some difficulty is that we have to treat every response as though the patient is COVID-19 positive. And the reason for that is we just don't know. You know, we all know the difficulties we've had with testing. So we just don't know, and therefore we have to treat everyone as though they're positive. And that means using an amount of PPE on every single call that we go on. And these are items that we used to be able to obtain for pennies in some cases. Surgical masks, you know, 4 months ago would cost us maybe 20 cents, 25 cents. An N95 mask would be less than $1. Now we're paying 5 or sometimes 10 times that amount. So every call that we go on, costs have increased, material costs have increased about $35, or I should say at least $35 per call. And that's just for PPE and decontamination supplies. That does not include additional labor, wages, decontamination time. And so it doesn't sound like a lot of money, $35, but when you look at the numbers of responses that we go on as a group, it adds up very quickly. And that's one of the main reasons we're asking for help. So what do we need? Again, in simple terms, we need, once the state Senate passes the bill before them today, and the state is allowed to accept federal aid, we need the governor to improve emergency rate increases for Medicaid, and we need to be included in every waiver request and every request that the governor makes for additional aid. There's over $2 billion coming into Wisconsin in federal aid. And that's one thing that's important to remember, is that this, at least, you know, these requests will not adversely impact the state budget. What we're asking for, and I keep mentioning Medicaid, and I should explain a little bit more. What we'd like to do is we'd like to see Medicaid pay the same as Medicare. Wisconsin EMS has not had a Medicaid rate increase since 2008, and at that time it was 1%. We've had no other adjustments. So really 2002 was the last meaningful increase that Wisconsin had. Wisconsin Medicaid pays about 42% of federal Medicare rates, which themselves are oftentimes below cost. So that's obviously a concern. In that same period of time, since 2002, wages and other expenses have gone up, in some cases 60 or 70%. So we want to sustain what we're doing. We're not trying to scare anyone. We're going to continue to do the job that we've been doing, and we're going to take care of people. All we're asking for is to be treated fairly. So what do we need? Again, we need help from the legislators, we need help from regulators, we need help from the governor. We're talking about a surge, a potential surge in Wisconsin. And, you know, if it doesn't come, that would be great. But I think, you know, there's still a possibility, and we have to be ready for it. Our call volume is unpredictable. No matter where we are in Wisconsin, it's hard to gauge how busy we're going to be or not be. Something happened when the state went into its safer at home order that none of us were really expecting, and that is the number of calls for help actually went down. We were all prepared for, you know, a surge in call volume, and we believe that's still coming, but so far our call volume has gone down. However, we cannot reduce our workforce because that reduces our readiness. And that's another reason we're asking for help. We want to be able to sustain the numbers of providers that we have available. We don't want to jeopardize that, because as soon as things start to ramp up, we want to be ready. I've been speaking a lot, and I apologize for that. I wanted to give an opportunity for our other panelists to join in. Marc Cohen from Wisconsin EMS Association. Would you like to add anything, sir?
I would. Thank you very much, Chris. And Amanda, thank you for putting this together and bringing all of us together. My thanks and acknowledgement also to Lieutenant Biggart and to Chief Bantes. I think together we do represent the over 18,000 providers in Wisconsin. And that's a really important thing during this very critical time that we stand together, and we do. So I wanted to put a little bit of a human face on some of the important statistics that Chris has been sharing, and just give you a little bit of some stories that I think will highlight some of the challenges that EMS faces. So I represent, the Wisconsin EMS Association represents the rest of the state. Despite us supporting paid services, volunteer services, for-profit, private, hospital-based, municipal-based, Wisconsin provides EMS services and care from frontline responders in many different forms. And I think that's important to acknowledge that no matter whether you're in Milwaukee or Madison or Rice Lake or Bloomer, that care given by those dedicated and committed, incredible men and women is unwavering. And 24/7, 365, EMS is available whenever it calls. So 80% of our state, almost 80% of our state, is supported by volunteer EMS. And what volunteer means is actually a number of different things. First of all, there are some true volunteers who do this just out of the goodness of their heart. They run when the tones go off. But many EMTs who are volunteers actually are paid on call or paid per call, which means that they receive some compensation. That compensation often is in the form of a few dollars per run or per call. These are medical professionals who work full-time jobs and then spend 24 or 20 or 12-hour shifts running nights and weekends for pennies on the dollar. They are the backbone of our state. We could not do EMS in most of Wisconsin without them. They deserve to be recognized and acknowledged as volunteers, but they also need the support that they, from the Medicaid reimbursement, from their communities. Volunteers are full-time and part-time, so they really do need that support. I wanted to share two quick stories with you, if I could, to put sort of a human face on this. I, like Chief Bantes and Lieutenant Biggart and Chris and I, do a lot of lobbying in Madison to educate the legislators, and we really appreciate them in terms of their support and their interest. And so one of the things that I've heard a lot this past year was the first time I've heard it in many years, which was I got some calls from a few legislators who said they had constituents who dialed 911 and no one came. No one came. And I said, okay. And they said, what's going on, Marc? What are we going to do? And I said, well, it's the same things that we've been sharing with you for years, that EMS is an underfunded, underrespected medical profession that needs your help and deserves your help. And so I said, it's going to happen more. EMS is the quiet service. We don't take a lot of credit. They are really self-deprecating, the folks who run with services. And so I went to the legislators and I also asked, I said, so this year, other healthcare professionals received Medicaid funds. EMS, as you heard Chris say, hasn't received it in over 12 years, an increase. Why not? Why not this year? There was money, why didn't we get any? And they said, candidly, you know, EMS doesn't have any good horror stories. You keep showing up. Think about that. We keep showing up so that if we didn't, we might get some funding. Now, no one would ever not show up. These dedicated professionals would rather wear trash bags and bandanas as PPE, quite honestly, than not show up to a call. And so I highlight those because these are some of the stories that not only affect rural Wisconsin and volunteer services, but also recruitment and retention for all of us in the city of Milwaukee, in the city of Madison, and larger metropolitan areas, and also those small communities that struggle to keep themselves afloat. As you've heard me say, those of you that I've talked to, volunteer EMS is supported on bake sales and fundraising. And that's not acceptable because we don't want any more stories of someone calling 911 and not showing up. So I appreciate the opportunity to share some of those with you, and I'm happy to add some more later on. Chris, thank you again for putting this together.
Thank you, Mark. We certainly appreciate different perspective. I've only ever worked in an urban area, so it's easy for me to lose sight of how things work elsewhere. And it's important for us all to remember, as we said, Wisconsin is a very large state geographically, and we have all types. Oh, looks like Dan needs to mute. Sorry, Dan. Chief Bantes does have a few things he wants to add, and we certainly appreciate him joining us. Chief?
Thank you for having me, Chris, and to be part of this press conference today. I speak, as president of the state fire chiefs, and about how this impacts us locally. All the chief officers and administrators of our fire-based agencies, our fire departments that do EMS services, our first responder agencies. At the local level, our towns, myself being the chief of the town of Grand Chute, our villages and our cities, obviously. And one of the things that has been happening for quite a while is that we're seeing really the crossroads of what Chris has explained as far as the funding not keeping up with what's happening around us. And I'm not just saying that as far as the situation of COVID, but this is just another round of impacts onto our agencies. What I mean by that is, we haven't seen any increases in that funding since 2008, but the cost of our ambulances have gone up significantly. The cost of our defibrillators, the cost of our IV solutions, everything that we need to provide good quality care, which is always the focal point of our agencies, is to do whatever we can for the citizens we serve. And then also to do that in a safe manner for our firefighters, for the men and women who are out there on the front lines delivering that care. And we really need, as you see today, 4 groups coming together as a team to educate the press, if you will, on how dire this situation is. And we need the state government to team up. We need them to say, okay, hey, we have your backs. We're gonna help you through this process. We're gonna help you with this situation that you're in, and we're gonna help make it better so we can provide the quality of care that Wisconsinites not only expect, but they want. And we want to be able to deliver that quality of care. As Mark said, we don't want any call to go unanswered. That's extremely important. And we're at a situation now where you have that funding level has gone down for years, costs have increased, and now we have a pandemic, and it could be, whatever it's going to be next time. But we need to be ready to handle this. And at the local level, and not trying to, speak out of turn or use a bad phrase, but there's no meat on the bones left anymore. there are no budget reserves. There are no funds left to tap into to help us out. Local funding is so tight, it's unbelievable. It is just absolutely unbelievable. There is no more something that we can fall back on. You know, we're extremely close, you know, in how we order stuff and how we do things and how we do our operations, you know, and we have to be very, very cognizant, because any slip in that move could cause quality care and even care itself to be dropped. So that's how tight the local budgets are, and that's why we need some of this help.
Thank you, Chief. Again, it's important to hear every perspective. As the Chief mentioned, you know, the four groups represented here today, we do have, we represent all types of EMS in Wisconsin, and that's what's important to remember, is no one of us has members that are more or less important than the other. Jerry, did you want to say a few things?
Sure. Thanks, Chris. I'm probably just going to either repeat or rephrase things that you guys have all said. Thanks for having me and the PFFW on the call. You know, we focus largely on the municipal side of things. And, you know, we were already barely hanging on before this. And I don't even know if we are hanging on between, you know, things that have happened with, you know, with our ability to generate any revenues or get new revenues. I mean, we have departments that for 10 years have seen their call volumes double and not be able to add anybody. Rigs are falling apart. We are already at a completely crippled position in many communities from the last 8 years of essentially every dollar hurting and every dollar helping. So when you see $35, that you wouldn't believe how much that helps on every call. It maybe doesn't look like a lot, but when you're already falling apart, $35 to help with overpriced PPE, now that there's, you know, this crisis going on, and, you know, God, where our ambulances have gone up, like the chief had said, they've doubled in price. And it just is, it's unsustainable when we've had absolutely no help with revenues in almost a decade. You know, we've got stations that are being closed, rigs that are being browned out and shut down. We're inability to really adjust for the growth in call volume as our less populated areas start to become, you know, kind of, you know, they were rural, now they're suburbs, and they've got real problems. And, you know, we're just robbing Peter to pay Paul, whether it's taking rigs from another city to deal with our downfalls, borrowing equipment, borrowing ambulances from one another when ours break. I mean, there's no backup. So the urgency is right now. And this is really, the back was already broken. So this isn't the straw that broke the camel's back. The back's already broke. So we need to do something, and it needs to happen quickly if people want this level of service to continue in the same fashion that they're accustomed to. Just like the hospitals are not working with the same money they were getting 8 years ago from Medicaid patients. We need this help, and we need it now. Thanks.
Thank you,
Chris.
Jerry. Thank you, Jerry. That was an excellent perspective.
Chris, I just have something to highlight what Jerry was saying, that, you know, I get calls, I've gotten a number of calls from some of our services around the state who indicated they've already run through their budgets for the entire year because of COVID-19, because of the PPE, because of supply demands on supplies. They've run through their entire budgets for an entire year already. And this is critical.
Yeah, absolutely. That is an excellent point. And again, we're not trying to scare, well, we're not trying to scare anyone into thinking that we're going away. We're trying to get the idea out there for everyone that we are in trouble and we need help, and there is help available. And that's the point to remember. There's help available from the federal government. We need Wisconsin to take that help and make sure that they share it with us. As the slide says, save some of the $2.2 billion for EMS. And again, if we just could talk numbers briefly, in order to do what we're asking long-term, which is to match Medicaid rates to Medicare, would be about $7.5 million in actual cost to the state of Wisconsin annually. Now, yes, that's a lot of money, but if you look at the overall state budget, it's really not. We're sort of a rounding error, as we like to say. So I think at this point we are ready to start wrapping up. We just want to remind everyone, we started 2020 in a precarious position. COVID-19 has hit us hard. We're bracing for a surge that we hope never comes, to be honest, but we want to be ready. We will be ready. We want to make sure that we are strong and we continue to thrive after that surge happens, not just for the rest of this year, but for the future. So I think with that, we can ask any of our participants, if you have any questions or anything you want us to go over, please go ahead and put it in the chat. I know Amanda's the moderator, so I don't want to steal her thunder here.
Thanks so much, Chris. So we're thrilled that there are 48 or 49 people on this call who are interested in learning a little bit more about how the state of Wisconsin can take better care of the people who take care of all of us 24/7. I posted in the chat box, if you would like to ask a question, could you please indicate in the chat box that you have a question, and we can either, I can either read it out loud on your behalf, or we can selectively unmute you. That way we don't have anybody talking over one another. So if you would like to ask a question either out loud or via chat, would you please, in either case, post to the chat box so we can make sure we do these one at a time. Okay, Elise Romas from NBC 15 has a question. Elise, are you able to unmute yourself, or I can find you in the list here and do that on your behalf?
I unmuted myself.
Here we go.
Can you hear me?
Perfect. Thank you so much, Elise.
Sure. Yeah, my question relates to the amount of funding and what you're asking for. So I'm just curious, I want to make sure that it's clear. When you guys are asking to be included in this emergency funding, and you're talking about matching those Medicare and Medicaid rates, is that something that is separate from what you're asking for? As this emergency funding, is that for what you need immediately right now to protect those people on the front lines?
That's a good question. What the Medicaid match to Medicare amounts is something we want to happen this year, because the state can use stimulus funds for that this year, and that's at least a good start. So that's $7.5 million for that. Aside from that, I guess we don't have a specific ask. We just want to make sure that the state looks at EMS and gives us something. We don't know exactly what that ask is, and I know that sounds like we're unprepared, but we just want, right now, we're not being considered for anything. So anything that we are considered for, we will consider a win. But we do know that the state can use federal stimulus funds to increase our Medicaid reimbursement for this year. And then we're hoping that, it continues after that.
Thank you.
I hope that answers your question.
Thank you, Elise. We have a question from, actually two questions from Ashley from the Milwaukee Journal Sentinel. I'll ask you them separately, if that's okay. The first question to the panelists is, what indications have you received from what indications have you from state lawmakers had that EMS would not receive any help from the stimulus? what indications have you from state lawmakers had that EMS would not receive any help from the stimulus?
Well, I think there's two answers to that question. Number one, we reviewed the list that was published by DHS that was requesting assistance for various provider groups in the state, and we were not included. To my knowledge, there was a list both from the legislature that occurred earlier and then from the governor's administration through DHS, and we were not included on either list. Also, in some anecdotal conversations with some of the state legislators, we were kind of given that message that, well, you know, it doesn't sound like you have a crisis, so, you know, we're not sure you need any help. And that's our fault, you know. We have done a good job and continue to do a good job, and we're not going to compromise that. And so that's why I think they maybe assumed that we were okay.
Chris, just real
Thank
quick
you.
on that, just as a follow-up, we are concerned because we've been putting on a very hard press for the last 5 years or more to try to get Medicaid increases. And we've struck out, whether it's going to DHS or, you know, trying to move the legislature. I mean, we certainly have some friends. There's no doubt about that, but we don't have a majority of friends. And so not only do we not see it now, but historically, all of our efforts, which we are bad at sounding the alarm, because that's what we do every day. We don't capitalize on a crisis. We don't scare people. We don't do the babies are burning or anything like that. We try to handle our stuff to alarm the public as little as possible about the problems we're having at all times. Most of the time you know, say something nice to an EMT or firefighter or cop, and their response is, I was just doing my job. And that's kind of how this whole funding thing has been going too. We beg and beg and beg and try to get you know, people to move in DHS or in the legislature for years now, and we just cannot move this boulder. And now we're just at a crossroad. So we have to try to do things like this to get some more light shined on us.
Yeah, that's an excellent point, Jerry. Thank you. You're absolutely right.
If I may remind us too that we had a wonderful meeting with the new Medicaid director recently and shared these very concerns with him and his staff. And so we're hopeful that that will help educate and put EMS to the front of the list.
Yes, absolutely. We are starting to make more noise, I guess, as a group, which is good. We've been pretty humble in the past, but I think after several years of being told no, we're ready to hear the word yes. Go ahead, Amanda. I was going to read the second question, but.
Sure. So the next question is, how have staffing levels held up as EMTs go into quarantine or themselves contract COVID-19? Are there any recommended staffing policies and procedures being enacted across the state?
You know, I can only speak for the service that I work for, but we've done pretty well. We did have some people quarantined, but the reduction in call volume actually helped that situation a little bit because even though we had some people quarantined, it did not affect our readiness. As for recommended staffing policies, you know, honestly, that's a very local thing. It's very agency specific. So it's hard to say that there's anything being done across the state. Again, because everything is different in each locality, it would be hard to have a blanket policy. I think everyone is doing what's best for them.
This is my follow-up question to that, Chris. Do you think some of the policies and procedures that organizations are using to protect their staff or to determine when their staff come back from work are driven by PPE shortages? Do you think people are making some decisions about those policies based on what supplies are available to them?
I think, yeah, I think a lot of agencies have had to make difficult decisions based on PPE availability, and that's a pretty sad state of affairs. in the United States that, we have difficulty obtaining a mask that's made out of paper. It's pretty sad. And so, yeah, it has happened, and it's unfortunate. Our decisions should be made purely on what's best for our providers and what's best for our patients. And I think that we've had to flex that a little bit because of difficulties that we've faced.
Thank you so much. And I think Marc wanted to weigh in on this as well.
Yeah, thank you. I'm hearing from the rural communities an interesting spin on that, and we're hearing it around the country as well. But with these folks who work full-time jobs somewhere else for employers, they're beginning to get pushback from their employers about not running with their services, and that's a really difficult thing to face because the communities are smaller in population, they have a greater need, they don't have as much staffing. And so here are employers who are saying, look, we don't want you to bring back potentially the virus to us, and vice versa. We don't want you to get sick, so you can't be here to work for us. And that's a real double-edged sword because any provider that goes down really hurts the entire system.
Yeah, absolutely. Absolutely. We also have to talk, I'm sorry, future recruitment and future readiness. We don't want anyone to be scared to want to become an EMS provider in the future because they think, well, look what happened. We couldn't even get masks to wear during this pandemic. So we have, not just as a state, as a nation, we have a lot of things to fix.
So talking about what it would take to fix this, you mentioned the $7.5 million. David Wahlberg would like to know, so you're asking for $7.5 million this year out of the federal stimulus and later in successive years from the state budget?
Well, yeah, so actually we're asking for $7.5 million every year out of the state budget. We just thought that this year having some stimulus funding available would be a good sort of kickstart to that. But we want it to continue. We're not just asking for a one-time a grant, if you will. We want this to continue every year. We want Wisconsin to be the same as Minnesota, where they do pay, Medicaid pays the same as Medicare in Minnesota. And they have honestly, they have a much healthier EMS system as a whole because of it. So it's proven that it works.
Looks like Rob Lawrence from EMS1 has an observation. He notes that we should not underplay the cost of readiness. It's vitally important to understand that we have to be there 24/7, 365 to wait for the next call. The funding model for EMS only pays for transport, so there's always a disconnect. And so even this small increase goes a little way towards balancing the books.
Yeah, that's a great point. And for those of you that know Rob, he is a very experienced EMS leader and known across the country. And he's right. The way we've been doing things is the way we've always done them. And, those are pretty dangerous words if you want to talk about evolving and improving. So, yeah, we've only ever been paid, we've been incentivized to take everyone to the hospital for years, and that's how we get reimbursed. And that's not always the best thing to do. Especially during a pandemic, actually, and we've seen that.
Okay, everyone, so we still have, amazingly, we still have 44 people on this call. Would anyone else like to ask a question of our expert panelists today?
Amanda, while we wait, I just want to point out, I know that we didn't get an opportunity to put Chief Bantes' email on the slide, but I did type it into the chat. So if anyone would like to copy that down, it's a little ways up, but it's in there. Oh, there you go. Thank you. You did that a lot faster than I did.
Wonderful. Well, I know that several people had asked about the cloud recording. I've put my email address, amanda@ambulance.org, in the chat box. If you don't mind emailing me, whenever, if you're interested in the cloud recording, I can zip that right over to you. It usually takes about an hour or so to cook or be complete and ready for download. So if you email amanda@ambulance.org, I can be sure to get that recording to you just as soon as it's done. Bram Sable-Smith, who wrote an amazing article about rural EMS just this week, said, thanks for convening this call. Bram, thank you for joining us. And then any closing words, President Anderson?
No, all I can say is thank you all for listening. Thank you for your support. We've seen humanity that we've never seen before. So there are positives that come out of this, and we're all going to learn from it. We're going to come out of it, and we're going to be better. So thank you all.
Thank you, everyone, for your time. This concludes the press conference, but we will share the slide deck and the recording with anyone that's interested. Also, most of you received a meeting request email from me, so please feel free to reply to that, and I can route any questions that you have for our panelists to the appropriate person. So thank you again for joining us today, and we hope that you enjoy the rest of your afternoon, or sorry, morning.